So I've had a lot of patients coming in lately asking me, Doc, how in the heck can pain down my leg have anything to do with my neck? Well, let me just lay it out for you. So this is what happens, okay? When people have like pain in the leg, like sciatic type stuff, it's the nerve pain comes out of the spine, goes down the butt, down the leg, or even down the front of the leg, but sometimes it goes to the knee, sometimes below. And what's happened there is a disc. It usually is bulging or herniated enough to where it's affecting the nerve that comes out there. Well, people say, well, just go get the disc fixed, right? Well, that's not very easy to do. First of all, that disc is there because of a compensation. Now, I'll get to that. But even the traditional approach, let's say you went to your medical doctor. What are they going to do? Well, they might give you a pain pill first, right, to try to numb the pain down the leg. Maybe they give you a shot, maybe a cortisone shot, an epidural, something to kind of numb that pain. Is that going to fix the fact that there's a disc bulging that's going down the leg? No, absolutely not. So where does that disc bulge start from? Well, believe it or not, it actually starts from somewhere much higher, okay? The very top of the spine or the very top of your neck just under your head. How does this happen? How in the heck can a problem here cause a problem there? Well, it's real simple. If one of the bones in the top of your neck get a little out of line, well, that head sits on top of those bones. So anywhere those bones go, the head goes with it. Well, you have a reflex within your body, within your head, that makes sure your brain is always balanced, always, okay? So if one of these bones got out of line, and this could have happened years ago, even just a little bit, what does that do? Well, it throws the head a little bit off balance. Well, the brain doesn't like it, okay? So what the brain does is it says, hey, I'm out. Get me back to level. Well, how does it do that? Well, when this bone misaligns, it gets stuck. Your body can't unstick it. So what it'll do is it'll start a chain reaction through your body. Might cause you to pull down one shoulder, might cause you to pull up one hip, and it's going to bend and twist and turn till your head levels again. Now, your head's level, but your spine has a curve in it. Well, what happens when you have a curve? Well, your spine's designed to be straight. As long as it's straight, those bones are lined up on top of each other. But if there's a little curve, then they have to kind of wedge a little bit. Well, what's going to wedge? Is it going to be the hard bone or the soft discs that are between it? Well, so those discs are kind of like a jelly donut. They have a little nucleus in the middle, and then they have these annular fibers all the way around. Well, that nucleus, that gel, is like a fulcrum between the bones to give you mobility. If the bone moves like that, then that gel is going to push out towards the side like a jelly donut would, right? If you squeezed it on one side. Well, that's going to create the herniation or the bulge, which can affect the nerves that go down the leg. Now, you can work on the low back. You can adjust the low back. You can manipulate whatever, and it might feel better temporarily, but if the cause is coming up from up here in the neck, which most of the time it is, it's never going to fix that bulging disc. Okay, so what we do at the Upper Cervical Spine Center is we're going to find the root cause of the herniation or the pain down the leg. Once we find the root cause, we're going to correct that. And promise you, 99% of the time, it's something going on up here. So we find a problem up here and we can correct it, then it'll start, those compensations will start working their way back out, and that disc will suck back underneath those bones to where it should be. It's going to take the pressure off the nerve. Thus, the pain goes away down the leg. Seeing it every single day. Many times, we won't even come close to that lower back. We'll just correct the top. Our patients will lay down a few minutes. They get up. All of a sudden, everything's realigned, and the pain down the leg goes away. It can really be that simple. So, if you have pain in the leg, if you have been diagnosed with a herniated disc or you have any type of sciatica or pain in the leg, find an upper cervical doctor, find someone close to you. If you're in the Charlotte area, give us a call. We'd be happy to check you out and tell you exactly where the cause of your sciatica, your herniated disc, pain down the leg is coming from. And then if it's something we can help you with, we'll explain that. If it's not, then we'll be happy to refer you to somebody else that we think can help you. So give us a call. We look forward to seeing what we can do to try to help you out.